Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. At the end of August the 21st, 2020, the global figure for confirmed COVID-19 cases was close to 23 million. Global recoveries were over 14.7 million, which is about 65% of all confirmed cases. And there were almost 800,000 deaths worldwide. The United States, Brazil, and India, which have cases in the millions, collectively account for more than half of the global burden. In Nigeria, there were 51,304 confirmed cases, 37,885 recoveries, and 996 deaths. The national recovery rate is 73.8%, and so far, 369,904 samples have been tested. From a record high of almost 800 cases on a single day, NCDC confirmed COVID-19 figures have dropped to as low as 69, but started climbing again and stood at 340 cases on August the 21st. Is this an indication of a change in the pandemic picture in Nigeria? What factors are responsible? Today we analyze the data. My guest is a public health physician, Executive Secretary of the Nigerian Academy of Science, and past chairman of the Association of Public Health Physicians of Nigeria. Dr. Doyin Odubanjo, you're welcome to the show.
Thank you very much.
So many figures. But first of all, let me even talk about the samples. We know that one patient doesn't get tested only once. At least we know that the patient is tested before he gets into the isolation center, and he's tested for his negative test. So we assume that these over 300,000 tests are not necessarily over 300,000 people, which means we don't have enough tests.
Well, actually, the test numbers, the number of samples tested on the NCDC site, ideally, what's projected to the public that way should be the screening samples.
Okay.
Which is the number of screening samples, because that's what makes sense to the public.
So just one per person?
Yes, well, basically, more or less. It shouldn't be the test you are doing in order to confirm that a formerly positive patient has become negative, which you may have to do 2-3 times before it turns negative and you discharge. If you count that as well, then, and you put that on the site for the public, it's wrongly interpreted. So what you should be putting are screening samples, which are the samples that you are testing in order to discover the burden of the disease in the population.
Yeah.
Not the samples that you are testing along the line of management of cases.
Okay.
That you will keep in your record somewhere.
That makes sense.
About the amount of work and how reagents are being used up. You'll keep that. But for the public, you shouldn't be giving the public that kind of figure. So we'll assume that these are 369,000 thereabout samples that were tested in order to find how many positive cases are in the society.
Okay. But then for a country of more than 200,000 people, this has been over the space of 6 months.
Right.
Even though tests have been increasing with time, we've been getting more labs, but now there are 64 labs. Is there any reason why we shouldn't get this test done faster?
I think some events, if I may take you back to some events that tell us about how one must be careful. I think when we had the Kano crisis,
Yes.
when over 2 weeks or so, there were many reports of deaths. There was a lot of push, to get the molecular labs running in Kano, in Aminu Kano Teaching Hospital, I think it was. And that happened. So they did activate very quickly, but they shut down very quickly also. Because right after opening, a lot of the people in the lab,
The health staff, yes.
Yeah, they got the disease. Because again, there wasn't enough time to put in proper protocols and proper training. Now, we have just recently seen a repeat of that in Ogun State.
Oh.
Actually, in OUTH. Olabisi Onabanjo Teaching Hospital, where also again a molecular lab was quickly activated with concerns expressed from staff, apparently from what we read in the news. But it was activated and it had to be shut down now, just about yesterday or 2 days ago.
For the same reason.
For the same reason. So we have to understand that some of these things take a bit of time. If you are dealing with highly infectious organisms, the labs that can manage those organisms are also quite specialized labs. You know, labs are actually graded. Biosecurity level 1, 2, 3, 4. You know, and the more infectious and dangerous an organism is, the more careful you have to be about what labs can actually handle that kind of organism, and the kind of training and protocol you must put in place before even that lab begins to do that. If you try to short circuit some of those systems, it could have very bad consequences. So I think that, again, the issue with Nigeria is that Nigeria has insisted so far on using only molecular labs,
yes.
You know, the PCR testing method, and has not been using the rapid testing.
And of course, it now takes longer because
it takes longer. So many people have been pushing, do rapid testing. Why not? You know, we need to test more, we need to test more, we need to test more. And I say, well, you need to balance that out. Because the answers are, the rapid tests so far are not very accurate. You know, what we will call sensitivity and specificity in medicine. You know, and that means that they will give you unacceptable numbers of false positives and of false negatives.
And that is a messed up system.
It's a messed up system. Even if out of 100 samples, or let's say out of 100 positive cases, the test you are using tells you that 2 or 3 or 5 of them are negative, when they are not negative, truly. That is dangerous.
That means spread.
That is spread. Now, if they were negative, 100 were going to be negative if you did the PCR, which is the gold standard test. But then your test tells you that 5 of them were positive, when they're actually negative. Okay. Now, the 5 people, what happens to them? If you had to put them in an isolation center, for instance, where there are positive cases,
they could get infected.
They could now get infected when they were not infected in the first place. So those are the considerations.
Why does anybody use those tests?
Well, the tests also could vary, sometimes in accuracy, depending on the environment where you're using them.
Okay.
But at the same time also, people would also use some of these things. In fact, they are probably being used underground in Nigeria, you know, because people just want to, you know, do something. They feel what you're doing is not working, is too slow, blah, blah. So but they don't have this kind of background knowledge that this is the danger of having a test that is not good enough, so to speak. You know, so while you might get away with it many times, what of the one instance when it's actually giving you a wrong result?
What do you think is the explanation for the cases nosediving the way they did in August and then rising again? And by the way, even with the last confirmed cases,
right,
it still hasn't gone up to what it was before.
Right.
What could that be?
Well, we would hope that the
flattening of the curve or August break.
The real answer is I don't know, and I'm not sure anybody really knows. Okay. However, there are many things one could be thinking about. One clearly would be that the pandemic is slowing down in Nigeria, and of course we'll be very happy about that. We are really happy to see that. So the transmission is not happening as it should. There are also some that have said, you know, that generally viruses tend to weaken,
okay,
you know, over time, and that could be good, even though there are also reports of the fact that there are mutations taking place.
Yes.
The mutation could result in a more infectious organism, even though not as dangerous as the former one. And that looks like the picture, but nobody's...
So with less impact, but spreading faster.
Yes, but that has been checked, studied in other parts of the world, not so much in Africa.
Okay.
That probably underscores the fact that research is key. And when we're talking about research, it is dynamic. You'll have to keep funding and funding research. People will have... So if you study the viral strains, for instance, 4 months ago, 3 months ago, it doesn't mean you can't repeat a study of the viral strains in the population now. And
meaning that it's evolving.
Yes, it's evolving.
Dynamic.
Yes, so you have to keep finding the answers and checking what is going on in your environment, as it were. I mean, the other thing you might postulate, which might not be so good, is that the moment we moved also to home management, we hope that it's not that people absolutely just abandoned seeking care.
Okay.
With government who say, after all, even government has told
that is something to think about. Because people could just say, well, they're having home management these days. I don't want to go to the hospital.
Yeah, you just say, well, even government has come to accept that they can't cope with it, home management is okay. So let me just sort myself out.
Those people out.
It will be difficult to get the records.
Especially those with very mild symptoms.
It will be difficult now to have records of those cases. One, they may not even get tested. So you may get people telling you, once I had one or two symptoms, I just thought this is it.
I have heard a few.
Well, I guess that's much,
But there's something that we cannot deny. At the beginning, in the first few months, the recovery rate was hovering around 30%.
But can I just say, just before you leave that point, that despite that, with increased testing and increased testing centers and all of that, including private, which would make more people comfortable actually to go get tested, except that it's not affordable to many people. However, many more people would actually go get tested because now they feel it's easier, to get tested there. I mean, those who can afford it. Then you see a general trend of this thing seemingly going down. The truth is that that's the best you can have, and you'll have to accept it as a good sign. That with increased testing, we're getting fewer cases. You will have to accept that.
Yeah, one thing that we can't deny is that the recovery rate has gone up.
Right.
In the beginning, we're not having this many recoveries. Now the percentage is beyond 73.
Right.
We're very, very glad about that. But we would like to know why.
Again, why is a difficult question to answer yet with coronavirus without research, to properly document those things. But we keep postulating. One of the reasons that could be accountable for that is the fact that, again, healthcare workers, the doctors, the nurses, are becoming more familiar. The more familiar, even globally, you become with a disease, you learn. It's like learning on the job. That, okay, when you see this, you need to do this quickly.
Okay.
When a patient comes this way, just start him on this. Follow this kind of protocol, and is likely to get well. In fact, don't even wait for this to happen. If you wait, you may not be able to handle it anymore.
Okay.
So people will get better at treating the disease. And I think also that in general, even the population are probably they're more reactive or more proactive, not reactive. They're more proactive. Everybody is more sensitive. So the moment people are having symptoms, they're not taking it for granted. They start off on something, whatever that is. So early treatment, perhaps for many, and then you get also the fact that even those managing it are becoming more proficient.
Could we be getting something like that herd immunity that people were talking about?
That's also a possibility. That's the truth of the matter. Some of us have heard that view for a while, about herd immunity. And the truth is that the only thing people have against the herd immunity is, okay, what would be the cost of getting to that 70% or more of the population having that immunity? But once you enter community transmission like we did, you are not likely to be able to control it too much. And the other worry people have is that when you have that kind of scenario, if you're talking about herd immunity, how long does immunity last for in those who have
that is going to be the next thing we tackle. But we need to go on break now.
Right.
We're going on a short break. When we come back, be with us in just a few seconds. You're welcome back. Please call the number on the screen if you have any question about COVID-19. You can also tweet at CTV_Mary A. While we go back to our discussion. Churches, mosques are now open. Service is in full swing.
Right. And people are happy.
albeit with restrictions. So half the people can't go to church on any given Sunday, and it must end in 1 hour. But, what would you say are the responsibilities now of the churches to actually bring this pandemic down in Nigeria?
Well, I think it's primarily provide credible information, believable. Let's call it believable information, because they are not going to generate any new information.
Yeah.
But basically, they are going to say what is being said. And the mere fact, actually, that you go to church or mosque and they tell you wear this mask and, wash your hands and all that, the people are listening to credible leadership.
Okay.
The leaders they believe in. And I believe that will strengthen the public health measures. I think, overheard the mosque near my house, and they were talking quite for a long time, about corona and all of that. One of the problems we've had is the message or the messenger is as important, if not more important than the message.
And the message.
And we have to exploit that, leadership that people believe in to say, look, help us. Because again, when you check the rumor management online, people are saying, oh, we don't believe it. It's a lie. The figures are this. But when the imam or the pastor says, you know what, there's corona, don't be careless, people believe that. So it's to pass that message, that same message across. But the strength of it now is in the messenger. That makes it work.
Okay, now let's just assume there's a spike in cases from these students who are in school doing their exams.
Right.
Because people are not thinking, it's as if people are just hoping nothing is going to happen. But what if something happens and somebody has the disease and it spreads?
Right.
And those people go home and there's a spike. What should be the course of action?
That's a whole big talk on its own.
And it's a frightening prospect.
Yes, it's a frightening prospect. And I think what I can say, just as a brief thing, is that I'm in touch with the head of the risk management unit of NCDC. Quite frequently we talk.
Okay.
And I do know that has been thought about, discussed severally with the right stakeholders, even teachers, Ministry of Education, the right protocol. What would you do if it was something like this? These are the kinds of considerations you should have. Just knowing even that has been thought about, documented, and all of that gives comfort, because even if it's a remote possibility, you have to think about it. You have to have a plan for it. And I can only say quite confidently that I know that has been thought about.
We'll be ready. Let's quickly take this call. All right. Let's take this call from Jegede, calling from Lagos. Hello, Jegede. Are you there?
Yes, I'm here. Good afternoon. Good morning. Afternoon.
Good afternoon. What's your question?
Yes, I just want to comment that expert that is here, he has broken down this coronavirus excellently. I want to appreciate him. But please, let him also talk about the herd immunity. For people to be able to understand, there are different concerns about herd immunity, and I am working in a lab. I'm a laboratory expert. One of the labs I support, I had about 6 people that are already being infected, and people keep on asking questions if they are infected for the first time. How many months will it stay? Is it 3 months? Is it 4 months? Is it 5 months for them not to get infected again? So without a vaccine, can we say in our population in Nigeria, do we really have an immunity, and how long does this take? Are you going to stay?
Thank you so much, Jegede. Thank you so much. So we're back to the question of herd immunity.
Okay.
Because this person working in a lab, about 6 infected people, and they're asking, how long is it going to last? Yes. And that if there's no vaccine, can we say that we will achieve some sort of immunity in the country?
Well, it also even has implications for vaccine development, because the question is a general question, not just about herd immunity by natural evolvement or being infected. As it stands, the current research points at immunity lasting around 3 months.
Oh, that is so short.
Well, as it stands, maybe there are things we don't know fully yet, okay? Now, the point is this. The way I like to think about it is to think about it compared to malaria immunity, okay, which is that malaria immunity is also short-lived.
Okay.
And malaria is very dangerous. I know most Nigerians have forgotten that.
But you know how we are so used to malaria that it's like nothing to us.
Yeah, so I'm trying to make this good, which is that it's nothing to us, but it's a killer disease.
That's true.
Okay. The reason why it's nothing to us is because it's endemic. So we live with it, which means we're constantly exposed to this organism, this plasmodium that causes malaria, and our immunity is almost constantly, that we almost constantly have some immunity that is being spiked, because of this exposure. Now, if you brought somebody from somewhere, in the West who's not been here for a long time and he gets it, you will be scared, and his chances of dying are quite high. Okay, because he doesn't have that immunity, even if he used to live here.
But corona is all over the world.
Right. So, but it's new to everybody. So we're all acting like that newborn baby getting malaria, or acting like the foreigner coming to an endemic malaria endemic
getting
environment
it for the first time.
Getting it for the first time. So that's where we are right now. Okay, but over time, even if you had corona, because that's one possible scenario. If you had corona becomes, COVID-19 become an endemic disease that is just there, all over the world, like flu.
Okay.
Then it means that constantly people's immunity you almost always have some little immunity that ensures that even if you have a disease,
it might not be too severe.
It won't be too severe.
I'm learning fast. Thank you so much for coming. This has been a wonderful discussion. And
pleasure.
Thank you for being with us. Thank you for calling. Please stay safe. Wash your hands, wear your mask, and keep your social distance. See you next week. I'm Mary Alale Yusuf.